Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. You know that we are making the serial, like a TV serial, Ayurveda in GP, Ayurveda in general medical practice, where we are discussing near about 55 plus problems that we face in the general practice, and where we can study the causes of that particular problem, investigations, and also the Ayurvedic prescriptions or Ayurvedic treatments. Now, today's lesson is about the dryness of the mouth. When there is a tremendous dryness in the mouth, that can be the problem of many patients. My dear friends, according to Ayurveda, dryness is a ruksha guna that is related with the vata dosha. Whenever our body is having vata prakopa, especially dhatu kshayajanya vata prakopa, whenever there is a deficiency of protein, carbohydrate, fats, whenever there are the deficiencies of rasa, rakta, mans, med, asti, majja, shukra, dhatus, then that is called as a dhatu kshayajanya vata prakop. And that is the main cause of this dryness of the mouth according to the Ayurveda. Of course, we are going to see the modern causes as well. Similarly, another reason for dryness of the mouth is excessive heat of the pitta dosha. So whenever there is excessive heat because of the pitta prakopa, your food and the lifestyle, then also you can suffer from the dryness of the mouth. So immediately you should have in your mind that there is maybe the dryness in your body, or there may be excessive heat in your body. So Ayurvedic principles are to control the vata dosha and the pitta dosha. Now you must know what are the causes of vata prakopa. Simple causes like not taking enough water, not taking any beverages like the milk or the fruit juice or the buttermilk, always eating dry, all the popcorns and pizza and fast food, no regular warm cooked food at home, then that causes the vata prakop. Hectic lifestyle, too much physical and too much mental work is also increases the vata prakop. Going to the bed late at night, in the midnight, at one in the night, then that can cause also the vata prakop, and that can create the dryness of the mouth. Similarly, you must understand what is a pitta prakop. Eating of excessive spicy, chili, pungent, sour, and salty substances, too much hot drinks, for example, repeated teas, repeated coffees, alcohol, smoking, drug addiction, all these causes the pitta prakop. Similarly, in your lifestyle, if you are working in the hot atmosphere, under the sun, or the hot chemical factories, or the glass factories where lot of heat is generated, then that can cause the pitta prakopa. Ayurveda says, Sanshepataha Kriya Yogo Nidana Parivarjanam. If you want to treat any disease, first try to find out the causes and try to remove those causes. Even not only physical level, but always consider the psychological factors also. For example, for vata prakop, excessive thinking can cause the vata prakop. Also, hot tempered, aggressiveness, jealousy, all these causes the pitta prakop. So you have to consider the vata dryness and pitta heat during consideration of dryness of the mouth. Okay, let us talk about the modern causes. Drugs taken for some other illness. If you are suffering from chronic sinusitis or coryza and you are taking antihistaminics, for example, chlorpheniramine maleate, okay, then levocetirizine or Instidal L. These are some of the names of the antihistaminic. Then that can cause a dryness. If you are taking any atropine or belladonna type of preparation, then it also causes the dryness as a side effect of that particular modern drug. Antidepressant drugs, tranquilizers, and hypotensive drugs can cause. So one must take the proper history, which medicines you are taking, which disease you are suffering from, and then accordingly you have to change that particular medicine, which will not cause the dryness of the mouth. So dryness of the mouth can be a side effect of present medicines. Then diabetes mellitus. You know the 3P in diabetes mellitus. That means excessive urination, which is called as a polyuria. Then excessive hunger, that is called as a polyphagia, and excessive desire to drink the water, that is polydipsia. Polyuria, polyphagia, polydipsia are the three important P reasons in or symptoms. I'm not reasons, that are the symptoms of diabetes mellitus madhumeh. So if the patient is diabetic, please don't forget to check immediate blood sugar. If it is too high or if it is too low, that can cause the dryness of the mouth. Ill-fitting dentures, dental problem, or fungal infection of the mouth, especially those patients who are in the ICU or taking the long-term antibiotics, and elderly patient, they are possibly having the fungal infection in the mouth. And last but not least, anxiety neurosis, psychological cause can be there for the dryness of the mouth. So simple investigations. The first, always, whenever people come to me as a professor, Dr. R. Deshpande, who is MD in Ayurvedic medicine and MD in Ayurvedic physiology, and we have the Ayurveda Academy team with expert doctors. There, we take the case taking of the patient. That is a paid consultation, only rupees 500 for one consultation. So if you are interested, you can definitely WhatsApp me on 9226810630. There we take such type of the detailed case taking, and then advice is given by the expert doctor under guidance of Professor Deshpande. So one has to do the fasting and postprandial blood sugar to rule out the diabetes mellitus, but glycosylated hemoglobin or HB1AC is more specific. That will give the average of last 3-month blood sugar. Now, treatment, if specific medicines you find out that causing the dryness of the mouth, you have to avoid it or you have to change that medicine. Excess of astringent taste food can cause the mouth dryness, for example, betel nut. Then screen for any underlying pathology. We have to find out whether it is a diabetes mellitus, and then you have to treat that particular disease very specifically. Try to maintain the blood sugar level by allopathy, Ayurveda, homeopathy, whatever you want. If no specific cause, please follow the symptomatic treatment. For example, home remedy, use Jeshta Madha, Glycer Hyza glabra. You can get it, Jeshta Madha, in the market, and you have to just suck it out. It's like a lozenges. Or amla, dry amla for chewing purpose, because that can be a lubricant and that can be the stimulant for secreting the saliva, because we have the salivary glands in the mouth that has to be stimulated by some what you can say, the lubricants. Okay, have a sip of lemon or khus juice, sip by sip every day. One has to consume specific medicines to control the heat of the body and the dryness of the vata dosha. Chandanadivati, sandalwood, thanda, cool, 2 tablets 3 times in a day with kokum sharbat, best kokum sharbat, raisins and black raisins, of course, and sugar candy for chewing or sucking. It's like a lozenges. I will also, here it has given Pravala Pishtivati or Pravalvati Hari Parshuram Aushadhalaya. That is a pharmacy in Pune city, in Maharashtra, in India, by Khadiwale Vaidya, which was my guru. Then Kamadudhavati Hari Parshuram Aushadhalaya, 2 tablets 3 times in a day. Eladivati from Baidyanath Company, 1 tablet every 2 hourly for sucking purpose, not chewing, sucking. Then that is called as lozenges, which will lubricate or give the smoothness or to all your, it will reduce the heat, it will reduce the dryness. Then Kushmanda Pak, 1 teaspoon every morning, that can also give the best energy. My dear friends, in this short video, we have discussed about the dryness of the mouth. I request all of you, please subscribe my channel to get fantastic videos by Professor Deshpande in a simple language, but in a scientific way. Thank you very much. I wish all the best. Take care and see you in the next video. Thank you.